Welcome to the Geek Vet YouTube. Today we have an amazing, extraordinary session for all the aspiring veterinary professionals who are writing ICRPG Vet Science exam. We are thrilled to be joined by an esteemed guest, Dr. Nirav Joshi, a renowned veterinary anatomist. Dr. Joshi brings a wealth of experience and knowledge that will provide us valuable information and help aspirants choose why they should go for veterinary anatomy and histology as their clinical subjects. Dr. Joshi has contributed significantly to the field through various roles. From 2017 to 2019, he worked as an assistant professor on contractual basis in the Department of Veterinary Anatomy at Veterinary College, Sardar Kushinagar. Between 2019 and 2013, he has served as a government veterinary officer in the Department of Animal Husbandry for the government of Gujarat. Since November 25th, 2023, he has been appointed as an assistant professor in the Department of Veterinary Anatomy at Veterinary College, Anand Kamdhenu University. In this exclusive interview, Dr. Joshi will be addressing some of the most important pressing questions from our audience. So get ready to dive into these topics and know more. Let's get it started. Welcome, Dr. Joshi. How are you?
Hi, Dr. Amaan.
Thank you, sir.
I am fine.
Welcome to the show. Before we dive into the session, why veterinary anatomy?
So, why veterinary anatomy? So, as we all know, veterinary anatomy it is the basic subject.
Yes,
The stream of knowledge it comes out from this base only. Whatever you will study in the during the tenure of the veterinary tenure, you will study the various subject on the basis of the knowledge of this specific subject only. If you will study the pathology or if you will study the normal medicinal approaches, so during this study you will one by one we will come in contact by anyhow by direct means or by indirect means you will come in contact with the various principles of veterinary anatomy. So there is a huge need to choose the veterinary anatomy.
okay, okay. When we were discussing on the preliminary call, you suggested you dropped out of veterinary surgery and radiology and opted for veterinary anatomy. How has this changed the trajectory of your life? Like, it's very common among students to go for the surgery, medicine, or gynae in their for their masters and their PhDs, and you dropped out of surgery and radiated for veterinary anatomy. How it has changed things for you? Like, what was your thought? Like, it must be a very, like, a fourth year in surgery or performing surgery, and here your veterinary anatomy, that thoughts people, the students have in their fourth year, like, we want to go by anatomy, it's very boring. And so, like, both are on the opposite pole, right? One is on the higher level, and then there is anatomy. So how has this been for you?
Okay, so as you have declared that both are the pole,
Yes,
but always between the pole there is always a connection.
exactly.
I want to give an
Please.
that that our the north pole of the earth and the south pole of the earth, they are on their extreme ends, but both
Yes,
ends they are connected with each other, and due to this poles only there is formation of magnetic field. Eh? So
yes.
whatever the case it is there, they are the two poles. When I want to talk about myself, how I have run from the surgery towards the anatomy. So until and unless I was in the fourth year, just like you and all of the students who are studying now, I was also very much affected, or I was having very much affection with this veterinary surgery and radiology. But
Okay.
in the very beginning, in the first year of my veterinary tenure, I have decided that I will be an assistant professor. In the first year, the goal was up right there. When
Okay.
I was in the fourth year, I was little bit attracted with the surgery, just like uh, all other students towards the clinical subject, because the clinical subject having the more opportunities, more fruitfulness it is there, and due to that they are more connect they can be more connected with the clinical subject. I was one of them, but at that
Okay.
present I have two minded condition. that one side the surgery it is there, which is just like a pull of fruit, and at one side it was my dream that where should
Mm-hmm.
I go. My dream was very much perfect that I want to become an assistant professor, and for that I have chosen the anatomy.
Amazing.
In
Amazing.
a very simple manner, if I want to elaborate, or if I want to explain you that pardon my language, the surgery it is just like a girlfriend, and anatomy it is just like a wife. You can fall in the girlfriend boyfriend relationship, but you have to be stable with your wife. So anatomy was just like,
You have offended so many surgeons now.
no problem.
This was something amazing, and you said very right. I agree with you on this girlfriend boyfriend wife thing, because if you are not anatomy is it goes hand in hand. Amazing, amazing.
And we are already, as we are already, okay, pardon my language, I'm not offending, I was talking about my, along with that,
Experiences.
along with that there is huge connection in between the anatomy and surgery. In the surgery, first and foremost lecture, whatever you will be studied, you will study in your surgical tenure, that is the tenets of first aid. And the
Yes.
point of the tenets of first aid, it is saying that the
Anatomical dissection.
section should be there.
Yes.
So just like that, there is the huge connection. Along with that, I want to share the one example over here, that
Please, please.
the anatomical principles which are present over there, whatever the course of the artery, course of the nerve it is there, or course of the blood vessel and the direction of the muscle it is there, until and unless you are not knowing the normal anatomy of specific structure, then you cannot perform any kind of the surgeries. Just like when we want to talk about the new VCI syllabus, they have included
Yes.
regional anatomy. Why they've included the regional anatomy? Because in a very specific region, foresight manner, so many structures are passing from a one aspect only. If you want to talk about the thoracic cavity from outside to inside, there are numbers of structures present over there. That, for an example, for the thoracic cavity, the outermost layer it is the skin, then the subcutaneous fascia it is there. After the subcutaneous fascia, it is completely covered up by means of the two kind of muscles, the external intercostal and the internal intercostal muscles, along with the thoracic cage. After the thoracic cage, the thoracic cavity it is completely covered up by means of the parietal part of the pleura, and the
Yes.
organs which are present over there, just like the two, one pair of the major two organs, the lungs are there, along with the heart, the major component of the body it is present over there, thyroid and the part of the thymus it is present over there, along with the arterial supply and the various two major vena cava, the anterior and the posterior vena
Posterior vena cava.
which are present within the thoracic cavity. So, by
Right.
knowing the regional anatomy or the anatomy of that specific region, or in the another word, the topographic anatomy of the specific region, we can do the better surgery.
Yes. Exactly. Exactly. I want to know, like we have discussed about this, why, because there is a lot of confusion, a lot of, not, I will not say confusion, a doubt with the subject veterinary anatomy. When people think with veterinary anatomy, they think they can only go into academia, or yeah, they can become teacher or professor or like AP, something like that. What they can do instead of going into research or PhD.
Instead of going into the research and PhD, when we want to talk about the veterinary anatomy subjects, so for the veterinary anatomy, it is not only concerned with the academics, it is
Okay.
also concerned with the research opportunities which are present not only in the India but in the whole world. There are so many opportunities to do the research, and I am not joking, you can do the innovation with this subject also. In a recent time, in the human anatomy, as we have studied the mesentery, it is the
Yes.
fold of the connective tissue which is the common connection between the, or it is the connection between intestine with the abdominal wall. I am not going
Right.
deep down into the definition of the mesentery. I am talking about the superficial part, because many of the students, they have just passed the veterinary anatomy, or they may are in the fourth or fifth year. So I am talking the superficial part. So we have considered it as a fold of the connective tissue, but in a recent time in the human anatomy, it is invented as a individual organ. Paper it is published for that, it is considered as a organ. So just like this, we can do the innovations, or it is well established fact, so we can do the research on a particular area also. When we want to talk about the research aspect, in the research aspect, uh, when we are doing, or when we are concerning with the various species of the animals, in a taxonomical classification, there are so many species which are about to explore, or they are there,
Unexplored.
they have kept, or they are present over there on the earth, and we have not explored at the present moment when we want to talk about the anatomical aspect. So there is so many research based opportunities are there, and just uh, keep aside a research based or the innovation based importance of the veterinary anatomy. National Aeronautical Space Agency, which is the US based agency, it is over there.
NASA.
This NASA, they are recruiting the veterinary anatomist at a par level of the veterinary surgeons. Why? Because the veterinary anatomists are the persons who are knowing the normal structure of that particular region, or the normal structure of that particular area, and they can also perform the surgeries. Along with that, the surgical, they are also putting the persons for the for the innovations in the surgical anatomy also.
Okay.
Not only the research and academic purpose, all other opportunities are also there for the veterinary anatomy. So there is a huge need for the veterinary anatomy subject. Okay, uh, as we are all knowing that there is very, what you can say, a few number of opportunities are there. People are saying that few number of opportunities are there.
Yes.
Just go in the universities of India and ask what amount of assistant professor they have. I'm not
Okay.
on this level or on this stage. I want to take an opportunity to tell you there is huge lacuna over there when we talk
Okay.
about the teaching complexity of the veterinary anatomy subject individually.
All right. Okay. Why do you think so? There is a lacuna in the field of veterinary anatomy in the academia.
First and foremost thing, just like me, there are few people in all over India are thinking just like that. They want to become assistant professor.
Okay.
Some are really want to be an assistant professor. They will go into the surgery or in the gynae or in the medicine. Why? Because they are thinking just like that. If we won't be the assistant professor, we will go into the clinics, or we will do the private practice, or if we will do the this kind of practice, or we will go into the various private sector areas. But when your goal, it is very much perfect clear that I want to become an assistant professor, then your, according to your goal, your practices should be just like this.
Practice what you preach.
Yes.
Okay.
To that, you have asked the lacuna, it is there. So very few amount of the students are there. They are joining the veterinary anatomy, and after that, yes, lacuna it is there. And when more and more number of people will do the post graduation, and just like this, they can fill up this lacuna.
Great. So there is a lot of opportunities in veterinary anatomy.
Yes.
Okay. Now moving towards a big question. Why to choose a non-clinical subject? What is the scope in any non-clinical subject? And how to select a non-clinical subject for your masters or your specialization if you want to? Why they should choose any kind of non-clinical subject, and what is the scope and how to select between any, like if they have to go for veterinary anatomy, physiology, or if we go into animal sciences, there is livestock production management, like how they should choose between these three subjects. What are the things they should keep in mind when they are choosing or when they are writing the paper?
uh, when you are choosing any subject, then as we all know, there are total two streams. When you are giving the ICR, GRF or ICR examination, mainly two streams are there: the animal science and the veterinary science. Subjects like the physiology, livestock production management, genetics, and likewise the subjects are present over there. In the veterinary science, the veterinary anatomy, pharmacology, parasitology, pathology, microbiology, and all clinical subjects are present in the veterinary science. Now, when you want to choose any kind of this subject, then first and foremost thing you have to keep in mind that what is your goal.
Okay.
Your goal is to become an assistant professor, or if your goal is to be a researcher, or if your goal is want to be a clinician, then from a very initial phase you have to choose your goal, and accordingly you have to choose your subject. Firstly, you have to think whether this subject is going to fulfill my goal or not, and if the answer is no, then never choose the subject. If you are, means you are a very good student during the study of that particular subject, but if the subject it is not making you your effort towards your goal, then don't choose that subject. This is the first and foremost advice from me. Second one, what subject do you have to choose? So in a very initial phase, in the first or the second semester, the student cannot decide that he have to do this and she have to do this. But from a second year of phase, some kind of idea should be there from a mind of a developing student or a studying student, that he or she has to go from here to which place, at which area he want to go and grow up. Just like me, when I was in the first and the second year, I was clear just like that I want to be an assistant professor. So at the first and second year, if your goal it is clear, you can easily choose the subject. One specific orientation program is there when we are entering, we are enter into the
College.
college, that these are this kind of the departments are there. So by seeing that seeing those departments, you can easily in a medicos or in a vetcos language, I can say, you can easily diagnose in which in which area have
Subject you want to go.
want to go. So
Right.
from a end of first and the beginning of the at the beginning of the second year, we can easily decide that I want to be a researcher, I want to be a clinician, or I want to be into the academics. If you are very
Right.
interested in the research purpose or basic specifically in the research field, then you should definitely go into the pharmacology, parasitology, pathology, just like the subject of anatomy and as well as the physiology. These are the subjects which will grow your individuality into a research field. Second, if you want to become the better clinician, then also you should follow the anatomy as well as the clinical subject. Just like this.
Okay.
If you want to be a better teacher, then in a, if you want to become an assistant professor, all of the subject, there is no any specific one subject present over there in which you can only be an assistant professor. All of the subjects you can be a better teacher. Okay, but when you are we are having the very speciality or very specificity for the specific subjects, just like the research or for the clinical activities, then you have to decide that I want to go on this side, I want to go on this side. So from that phase only, you have to decide in which field you have to go, or in which field you have to opt in your future.
Okay. You should be very clear from the first or the second year in which subject or the area, is it veterinary sciences or animal sciences, or you will get the hang of it. You should know where you want to go in future, and you should study in a very connected way. If you want to become a teacher or a surgeon, you should find connected subjects and study in that way from the very beginning.
Yes, yes, absolutely. And some of the people are that they cannot connect with the subject up to their fourth year also. But there is no need to hide. If you are getting a connection with a specific subject in your fourth year, then do your best from the point when you are realizing that yes, this is my subject, and I can connect with this subject very beautifully. Then start from that point only. A very tremendous result you can get if you will completely be in connected with very specific subject. When I want to talk about myself, or just for an example, when I was in deep connection with the surgery, this is the reality. When I could not, to be frank, I could not get any good marks in the surgery. I am confessing in front of all of you. I could not got any good marks in the surgery, but I was having very much deep connection with the surgery, that my whole bed, it is completely surrounded by the books of surgery. On in front of me there was a book of Dr. A. Venugopalan, The Essential of Veterinary Surgery. Just beside
FSG,
dominant surgery, it is there. R.P.S. Tyagi uh,
Tyagi,
have wrote it. Then the veterinary radiology by Dr. A.P. Singh and Dr. Jeet Singh sir. Beside that, its letters fundamentals of ophthalmology was there. When I was talking about the fourth year external examination, so this letters fundamentals of ophthalmology was there. The small animal surgery was there for specifically dog and
Fo-
cat. So
Fosam.
I could, for the fossum, I could not get very much marks, but at the present moment also, I can recapitulate that in the fossum it was written that the belt gastropexy and VU blepharoplasty it is there. I can recollect the VY blepharoplasty, and just like the surgical interventions which are performing for the treatment of entropion and ectropion, along
Ectropion, right?
the enteroanastomosis, the techniques of the enteroanastomosis, and
Moses.
just like that. So by the connection, you can get whatever the knowledge that subject have. The all of the subject knowledge you can gain by just keeping your effort into that subject. But that was a temporary connection with that subject, and basically I was the person of academics, so I have chosen for the anatomy, just like this. So you have to just be
Okay.
a most or the highest level of connection with this subject.
Whichever subject it might be, that which interests you, you need to put in the efforts. You need to read the text.
Yes,
You need to stay connected with the books.
you have to stay connected. Just like if you are in a, it is a very few people, they are interested, they will be interested in the subject, just like the livestock products and technology. But if someone
LPT.
completely interested in the livestock products and technology, he or she won't see the milk. He or she will definitely see the byproduct of that milk, that what I can better from this milk,
May
from this milk product.
exactly.
So
Exactly.
don't judge me that I am people and the animal for the dissection only. Eh?
Yes, yes. No, no, they will not. They will not. Definitely, my audience will not judge anyone. Okay. Now the next question that we have got from our audience for this ICR exam: how to get your favorite subject?
For this, I want to quote the best quote, which is quoted by a supreme authority of the world, Sri Krishna, that karmanye vadiga mafaleshu kadachana. Just like this, do your karma and forget about all things. If you want to get your favorite subject, firstly choose the specific stream. Whether my subject it is coming under the animal science group or it is coming under the veterinary science group. Okay. If want to go with the subject of animal science, just like the animal genetics and breeding, then forget about all of the subject. You have to just stick with the specific group of the subjects in the animal science only.
Animal science,
You are
yes.
connected with the veterinary science, but forget about the animal side, animal science side. I'm not talking just like that. Forget means just get failed into that. No, just get passing or there in that subject. I'm not giving a misleading uh, what you can say.
Statement.
Don't want to mislead anyone, but if you want to desperately get that one subject, then forget about the others. If you will only get the passing mark in that specific subject, there is no need to worry. If you will prepare for your goal subject, and if you will prepare in a very much huge amount from your mind as well as from your studies, you will definitely get your subject. Along with that, you will master in that, and you will also get the best institution from your side. Over here also, the example, it is in front of you. I was very much poor student for the subject of the genetics. I was having only passing marks. But you should have
Okay.
of the desperation for your subject. Okay, I'm not telling that just keep all of the subjects beside and focus on your subject, focus on your. I'm not telling just like that. But you should have that much patience, and you should have that much ability to read.
To summarize what you said, you should select your favorite subject, put more efforts on that specific subject of that stream, be it veterinary sciences or animal sciences,
Yes,
and that's you should devote more time to that subject.
yes,
And obviously you should prioritize other subjects as well, because not every subject is going to same. You are not going to get same marks, or you are not going to feel interested in the same subject. For me, it was veterinary extension education. It was so boring. This was me. I was interested in the subjects like LPT, parasito, VPH was there. I was interested in those subjects, and I had to put more efforts just to get done with veterinary extension. So you need to prioritize and change plans according to the interest and the efforts the subject is asking.
yes, absolutely.
Okay. Now the next question that we have: what subject have more weightage of marks and how to prepare for them?
Okay,
Like,
basically, I have
yes.
to emphasize more on the veterinary science group because I was one of them. So, in the veterinary science stream or in the veterinary science era, specifically in this paper, mostly it is divided in a manner that the preclinical, paraclinical, and the clinical subject, and the questions will be in a format of 1 by 4 to 2 by 4 to 3 by 4, and
Okay.
you can say 4 by 4 like that. Likewise, a ratio of just like this: 1 by 4, 2 by 4, and 4 by 4. Maybe this ratio change and reverse the pattern like the preclinical, clinical, preclinical, paraclinical, and the clinical subject. Likewise, this subject ratio will be reverse: 1 by 4 portion from the preclinical part, 4 by 4 from the paraclinical part, and 3 by 4 ratio will be there in the clinical part. Likewise, but mostly whatever the questions are there, when we want to talk about the specific subject wise from the anatomical portion, in a most of the paper which what I have already solved, or at my examination time, at that present time and the recent time also, I have watching the question paper style. Mostly from the anatomy, they are asking about the avian anatomy, more over
Okay.
the avian anatomy. Okay, and mostly they are emphasizing on the in the gross anatomical area, they are emphasizing on the avian anatomy, or in the when we want to talk about the histo and embryology, mostly they are emphasizing on the specific histological structures as well as the specific germ layers from which the various organs are developing, just like that, or their primordias. This I want to talk about.
Primordial germ layers.
This is for the anatomy subject specifically. Just like this, there will be a huge amount of questions from the paraclinical subject, just like the pharmacology, pathology, and this
Microbiology.
health and the microbiology. And they are having the huge amount of ocean of knowledge is there. When we want to combine this, the microbiota, just like the in the microbiota, there is the inclusion of microbiology, pathology, and the pharmacology and public health, like
Everything.
everything it is there. So it is the ocean of question.
Now to this microbiota, how we can tread this microbiota, because BVS, if we talk about veterinary sciences, it's a vast ocean of knowledge. How we can
Absolutely.
study for that? How we can study and prepare, because there are two groups: those who are studying from the first year, like making notes and all, and there is one group who is just like a day before the examination going through PPTs, solving MCQs. So we need to tackle both the groups. So let's take the first part, those who are studying from the very beginning and preparing notes, how they can tackle this microbiota.
So, to tackle this whole microbiota or the whole ocean of this subject, firstly, you have to prepare the media for the isolation of this microbiota.
Okay.
In a language of biology, you have to prepare
Yes.
medias to isolate
Yes.
culture the all bioorganisms. So when you are studying for the paraclinical subjects, there is no, I absolutely want to say, there is no any kind of shortcut for this. There
Okay.
is no absolute shortcut. Yes, definitely you will get the shortcut for the preclinical subject. I want to talk about my also. For my subject also, you can get the shortcuts for the anatomy, but you won't get any
Okay.
for the paraclinical subject. You have to deep down into that ocean only. Okay.
Okay.
For,
Okay.
for a person who is preparing from the very much first year or the second year, they can prepare during their day-to-day study or during their examination studies. He or she can write down a specific words in so many books, just like in the general veterinary pathology. If I want to recapitulate, in the general veterinary pathology by Dr. J.L. Weger, along with the special veterinary pathology by Dr. J.L. Weger sir, which is
Good.
written by them.
Yes.
That
Yes.
specific book, whatever the important portion it is there, it is uh, just
Bold.
from the normal text. Okay, they are
Yes. Yes.
bold letters are present over there. So you can
Yes.
down these small notes from that bold letters. So you can get idea that this kind of the questions can be asked in the examination, or you can get the basic idea. Yes, that this kind of the questions or this kind of the knowledge I should have, that I can compete in the this competitive exam. Okay, this one it is the first point. Second point, you can make a short notes. I'm not talking about the long sentences. I want to tell you about the small notes. That the specifically when we want to talk about the any specific disease, then for the etiology, you should not write down that the foot and mouth disease it is caused by the this specific kind of
Aphthous virus.
the picornavirus. Okay, just write down the FMD, and over there you have to just write down the picornavirus. If you want to talk about the
Okay.
rinderpest and morbillivirus of the paramyxoviridae or whatever it is there, but this kind of the note should be prepared, and in a manner, in a 3 to 4 line, you can include a whole the disease. Okay, for just for example FMD, you in a line you can include the etiology for that specific disease, just like the picornavirus. In a second line, you can specifically include what are the special postmortem lesions and what are the gross lesions you will see when the animal it is alive. So in a one line you can see that the lesions will be present on the lesions that present on the coronet and the mouth region or within the oral cavity, erosions or the vesicle formation it is there, and then the erosion, the ulcers are there. In a third line, in a very much third line, okay, in the second line along with the gross, you can write down that tigroid heart necrosis you will see in the calf.
Yes.
The heart necrosis and the calf, these two words, they are very much enough. When you will see that words, you can recapitulate that, yes, in the calf the tigroid heart necrosis will be seen in the foot and mouth disease. The
Mouth disease.
third line, very in a very short form, prevention and control, or if medication it is there. So in a prevention and control, vaccination should be there.
Nation.
These strains OAC, Asia 1 2 3,
183.
and the set 1 2 3, just like
Yes.
three line, in a just three lines of a full scape, you can include that whole disease. There is no need to write down long
Okay.
kind of short. You can recapitulate whatever the, or you can remember the things whatever they are present within your that long full scape. Okay, this was about the players who are playing for the test match. But now
Yes.
we will talk about the players for which they are playing the 2020 matches, just like
Okay.
the veterinary subject. So, firstly, I want to tell you there is no shortcuts. Always there is no any kind of the shortcuts in any kind of the field. This is not for this field only, but few. These are the, what you can say. These are not
Tricks.
shortcuts, or these are the stairs. These are the
Okay.
long stairs, or you can say, yes, you can say the tricks by which you can study a whole subject in a very short form. That if you want to play the 2020 match, in that case, don't go for the preparation of notes. This is first and foremost advice from me. Don't go for the preparation of notes. You won't cope it, my friend.
Okay.
Do that.
No notes.
No notes, no notes. You won't cope up it, because if you will waste your time for the preparation of notes, so after the completion of examination also, you will dare to prepare the notes for your next batch. Just don't do the kind of the things. Consume the highest number of MCQs. Yes, and
Okay.
you consume, just drink highest or eat highest number of multiple choice question. Whatever you are seeing in front of your eyes from any book, any of the book
Okay.
of the, means if you are from the veterinary science field or if you are from the animal science field, just go for the highest number of multiple choice question. From whenever you are getting any kind of the question, just consume it, but not in a form that you are taking a medicine and you are not knowing what is the exact mechanism of action.
Action.
Not be the case. If you are having
Okay.
a huge autoimmune disease, if you will have the huge autoimmune disease, and or in a other example, you are having the immunosuppression and unknowingly you are taking the higher number of dexamethasone, you will definitely get suffer. So
Yes.
don't get just like this. Consume highest number of multiple choice question, but before consuming, must understand what that specific question is want to say, and along with that, what are the other type of question can be made or can be asked from that specific question. So if one kind of the question it is that the all kind of the accessory cell glands are absent in, four options are the cattle, the buffalo, dog and the aves, or in the birds. So all accessory cell glands are absent in birds, as we all know. But by this question, how many questions can be developed that prostate is the accessory cell gland present in? So that from that four option, the dog will be the answer. Okay, just like that, if from the same question only all accessory cell glands are present in, then the option just be like the ox, dog, birds, and none of the above. Then the answer will be the ox. So I am giving
Ox.
the example that from one question how much the possibilities are there that this much questions or this kind of the question can be asked in your examination. And for this kind of a practice, you will need only 3 to 4 minutes of your time when you are playing the 2020 match in the last month.
Okay.
For an
Okay.
individual question I am asking, for an individual question I am telling you. So just like
Got it.
manner, you can prepare for your examination in a fast forward manner.
Okay, like if you're you have to solve multiple MCQs, and if you're solving one MCQs, go through that question, try to find the reason, and try to make multiple questions out of that MCQ.
Yes.
The example you gave of accessory sex gland is present or is absent, all are present. In that manner, you have to solve MCQs and find the reason to that answer, why this is the answer to that question.
Yes.
Okay. Okay, now this is how to prepare to the point rather than going through all the BVSC lengthy notes. Like if you have all the notes, how you can just revise revision, because revision is also important before you are going to write the examination. How you can do that? Any suggestions, sir?
Whenever you are going to face the examination, and this I am practicing, this I was practicing during my undergrads along with in my postgrads and during the examination of ICR also. Just leave your studies before 2 hours of examination. Just
Okay.
all studies, all study material should not be with you before the 2 or you max to max 1 hour before the examination. Because some of the people they are having the habit to take the notes until to the up to the last moment of the
Examination
all.
date.
Okay, this should
Yes.
not be. Whenever you are
Okay.
studying, you won't able to remember any of the things from the last minute reading. Okay, instead of that, you can make a small notes, a small objective type of note, and you can just read. I want to say that just don't read before the exam, 1 hour of the examination. But if some of the people they are saying that no, I want to study before the examination, then a 2 to 3 page of the objective note should be there, and that should be also leave down before the half an hour of the examination. Just calm down your mind, and by the full confidence or by developing that self confidence, just give the examination. You will definitely score the better marks than whatever you have uh, thought about.
So far, we have discussed how to prepare for the examination from the very beginning of the first year, or like in a very short term or a month or so for your ICRPG examination. Now, this is a very good question, and many people are not aware. Is there any different choices available in veterinary sciences like exotic, wildlife, or ophthalmology? Like, are there any specific, should I say, species specific or system specific master's program under the MVSC?
There is no any system specific postgraduate programs. Absolutely not. There is no any kind of this system specific programs have been developed. When I want to
Okay.
the species specific programs in a North Indian region, you can get some kind of the specific research program. I'm not talking about the master's program. Research program on their regional animals.
Animal.
Animals. Okay.
Okay, so it's like universities in the specific area are conducting some kind of research in the veterinary anatomy or surgery department, so you can like work on those research during your masters.
Along with that, some of the diploma programs are definitely there. That Gadwasu have developed the CAFT training on the ultrasonography, specifically on the ultrasonography.
Ultrasonography.
What that medicos they are used to tell the radiologist and the sonologist. So just like
Yes, yes.
the veterinary sonology or veterinary ultrasonography, they have developed the CAFT course for this or diploma course for this sonography. Just like that, in the, I don't know the exact state, but in the South India they have developed the this course for the ethno veterinary medicine,
Yes.
and they are
And even IVRA also have such courses, to my knowledge.
PRI have also this kind of the courses, and
Yes.
they are conducting in the form of diploma, as well as they are conducting in the form of training, which they are giving to the assistant professors of the various colleges which are present in the in India.
Okay. Now the next question we have: which subject is best to opt in MVSC to make a good career path?
This is
Difficult question.
a very much difficult question, and you can say that in Hindi
Okay.
यार बम भी चल है जब हम बात करें इस सब्जेक्ट इट इज बेस्ट
And to make a good career path.
make a good career. But for this, I want to answer in a manner that the subject in which you are having your gut feeling and in which you are having the highest amount of connection, that subject, it is the best subject, and it will definitely got you the job.
Good career path has to be made only by you, by your efforts in the subject of your liking.
Definitely. In a
Okay.
very simple manner, when I have completed my BBS and AS program, and when I have entered into the field of anatomy, I was just knowing the extensor and flexor group of muscles and the names of the bone and very few structures which are present on their surfaces. Other than that, I was totally blank for this. But fortunately, I got a very much affectionable and can be understood person. Two persons are there. They are present moment. I got two persons from which I got a what you can say. Uh, I got
Inspiration.
abilities to explain the veterinary anatomy subject. Okay, I want to
Okay.
congratulate and thank them. uh, Two professors are there, Dr. MC Desai sir and Dr. KB Patel sir, two are there in at the Jatiwada Veterinary College. And after joining this, uh, I could understand that this much amount of depth and this much amount of the fruitfulness can be created in this kind of the dry subject. So I have developed the interest, and what by after keep moving towards the front side or from the upside on the one to one stairs, I just
Mm-hmm.
to know that this much depth and this kind of the perfection can be created in this subject.
Okay. 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 Now, as we are reaching towards the end, this is a very good question. And to end this conversation, how to avoid boredom and increase concentration during the last month of preparation?
Okay, during the last month of preparation, if you have prepared from the very beginning, from your first year, then there is no need to worry for you. Okay, the person they have not prepared from the very much beginning, they also don't have any kind of the tension like situation should be there. But to avoid the boredom, one person should always take a 10-minute of break in between 2 hours. In between two
Okay.
subsequent hours, there should be a 10-minute of gap, and you have completed the 1 hour of reading, then take a 10-minute of the break, then again you start your reading. If you are feeling a very much boredom in one subject, so after 1 hour of the study, you can keep the 10 minutes of the break, and then you can continue with the another subject. So you will,
Okay.
or your brain will not get completely bored in one subject. It will get some kind of the energy, and then if you will study the another subject, then it will feel like, okay, this is some kind of the new information, so it will
Mm-hmm.
be refurbished, and you can gain the amount of knowledge which another subject have. Okay, during this period, during the 10 minutes of time, just forget that you are a student from either from the veterinary side or from the animal science side. Just forget
Okay.
all things and enjoy that 10 minutes. Don't read anything, just drink water, or keep a full amount of the glucose water or the energy drink should be there, and you should take that water or that energy drink during that 10 minutes only, because get boredom. If repeated actions are there, that one it is the first reason. Second, if there is the huge amount of low energy or least energy stage, these are the two conditions when you will for the feel the boredom.
Okay.
Thus, you remove this two main important reasons for your boredom, and you will definitely get some, or you will definitely get the that level of the freshness that you can study the another subject, or you can continue with that previous one only. Okay, some of the
Okay.
persons or some of the students, they are uh, they are doing a practice just like they are just sitting at a one position, and they are just reading in a manner that they are only reading. They are not actually remembering, they are actually not understanding, they are just reading, they are just keep reading. This should
Hmm.
not be the practice. You just read. If you are not under, you cannot understand, just read and write down it. Then try to get explanation from your teachers. If you are very much shy, if you are feeling very much shameful to face to your teachers, then ask to your friends and just get the explanation, just understand it, and then you try to remember it. And
Okay.
don't just sit and read for a period of long hours. This should not be the practice. Take a small break in between the 1 or 2 hour of the reading, and you will definitely will not get any kind of the boredom during your studies.
Okay. 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 Thank you so much, sir, for giving your time and helping students out for the ICRPG Vet Science examination, and also telling and breaking people's myth about veterinary anatomy and histology and embryology. This was Dr. Nirav H. Joshi, sir. Thank you so much, sir. Anything you want to say before we end this session?
So, firstly, I want to thank you that thank you so much, Dr.
Thank you, sir.
Ghazi, to provide
Thank you, sir.
platform that
My pleasure, sir.
I can connect with all of the students from all over India, and uh, along with that, I want to share that by this kind of the platform, you are providing the knowledge, whichever it is remained below the very thin layer of the shyness maybe. Okay, you are bringing out it, and keep going, keep doing this
Thank you so much.
work, and
Thank you so
god,
much, sir.
god bless you and all the best to
Thank you. Thank you, sir. Thank you, sir, for this appreciation and for giving your time and efforts for making this happen. Thank you for your interest in veterinary medicine.
thank you so much.